See, we have to remember the difference between unfractionated heparin, low molecular weight heparin, and fondaparinux. So what happens is that in unfractionated heparin, there are long saccharide chains and it is found naturally in the environment. And remember that we are trying to inhibit factor 10 basically in the blood. So the molecules that we require to undergo would be not be taken orally, because they would ultimately be digested. So in body, if you have to target factor 2 or factor 10 per se here, then it has to be given IV. So all the three drugs are given IV. And now we come on to their clearance metabolism. See, unfractionated heparin is of high molecular weight. Just take the reverse situation. If this high molecular weight substance is allowed to go into the kidney, then the kidney may shut down, because it cannot process this much of in renal tubules. So God has given the mechanism. Fine, you are a high molecular weight substance, you will be processed in liver. So therefore they are processed in reticuloendothelial system, and therefore since they do not use renal, so therefore they are safe in renal impairment, and they are majorly in affecting the intrinsic pathway here. So aPTT is affected. See, very often we are getting confused that what is aPTT and PT associated with. So aPTT here is a couple always remain inside the house. So when they remain inside the house, they are intrinsic pathway, and PT is extrinsic pathway, because when you are single you tend to roam around in the city. So we can monitor it by aPTT. Protamine sulfate can do full reversal, but like other natural things, it has it can cause heparin-induced thrombocytopenia, which is evident in their name only. And then there is a risk of osteoporosis. Why? Because it is such a high molecular weight substance, it tends to attract calcium towards it, and when it tends to attract calcium, then it will lead to osteoporosis. Now we come on to the low molecular weight substance and the fondaparinux. These substances are all cleared by the kidneys, because they are of low molecular weight. They can be processed by the kidney. So why should liver, which is already overburdened, should be given the job of clearing them? And they are since the people will have suffered in unfractionated heparin, so they tried to eliminate its bad quality while manufacturing low molecular weight heparin and fondaparinux, and they were able to do so. How? First of all, they direct putting in the blood in the IV, they started putting subcutaneously, because subcutaneous is absorption is slow but good absorption, and it will not fluctuate the coagulation factor. And low molecular weight heparin is monitoring required only in renal impairment, and this we all know that since they are low molecular weight, they will not bind calcium, and no such osteoporosis will happen. Now, for a clot trial, we should remember that low molecular weight heparin is used for cancer thromboembolism that was evident in clot trial. Okay? Why? See, there is no logic why it is used. There is no such reason. It was just saying in clot trial that for cancer thromboembolism, low molecular weight heparin is used. So you can remember by that here already the weight is too high, because cancer have high molecular weight or high number of cells there. So we need somebody low here, so that in total the things are balanced out.